All right, welcome everyone into Fairview Park Hospital. Here we are again, and this time with Dr. J. Curtin. And you are the radiologist here at the hospital, actually manager of radiology, correct?
That's correct. I'm the medical director of radiology, yes.
Okay, thank you for that title. And so, ladies and gentlemen, we wanted to come in today and just have a moment with Dr. Curtin, be able to share a little bit about the advancements recently at Fairview Park Hospital. As we always like to point out, Fairview Park is always looking to take the next step to bring better medical attention to you. The latest procedures is what we're here to share with you today. And Dr. Curtin, now, first of all, about the field of radiology. Let's talk about that. What is radiology, first of all?
So in radiology, what we do is we produce medical imaging, and we look at these pictures to make diagnoses and help doctors decide what the disease the patient has and how to treat it.
All right, so if we go back and we think about, that type of thing, imaging, you think of an x-ray.
That's right.
And that's pretty basic.
X-ray is pretty basic, but we have other modalities that we call them. There's CT or CAT scan, there's MRI, and then there's other things like nuclear medicine and ultrasound that we use to make diagnoses as well.
And the advancements just keep coming, don't they, Doctor?
That's right, they absolutely do.
And how important is this imaging that we talk about?
Well, imaging is really critical to diagnosing and treating diseases. I would say that perhaps not a majority, but certainly many diseases that you go to get treated for at your doctor, they will want some sort of imaging, be it X-ray, ultrasound, or CT. It happens a lot.
Yeah. All right, and so let's talk about the department, the advancements, and what type of radiology that you're actually bringing to the field now.
Sure, and a lot of what we are talking about, Fairview Park has had for a long time, but in many cases we're upgrading or advancing the radiology and the imaging that we have. So the mammography that we do is now 3D mammography, which is a better type of mammogram, and you're going to see that adopted all over the country. A lot of hospitals are now doing this. That's one example. And then our interventional radiology program is also something that we think we're bringing to the next level here at Fairview Park.
Okay, so what is that?
So interventional radiology is a subset of radiology where, in addition to taking pictures, we also use needles and catheters to perform procedures on the patient to help them avoid surgeries. So in many cases, it can be thought of as minimally invasive surgery.
Okay, so what do we say, what types of surgery could be avoided, or could you give us a few examples?
Yeah, so a great example is a procedure that we call kyphoplasty. When you have a fracture in your back, a lot of times in older patients from osteoporosis, typically what would be involved is, if not surgery, certainly a long period of bracing. But sometimes those would be operated on. Well, now we are able to take needles, put them through the skin into the vertebral body, and inject cement to stabilize the fracture and keep the patient from losing curvature of their spine, which is what you see a lot in osteoporosis. So that's one example of a procedure that we do.
Dr. Curtin, you've been with the hospital for a short period of time
Correct.
now?
That's correct. We've been here since May.
All right, let's talk about your team.
Yeah, so our team, our team is called Summit Radiology, and we have 24 radiologists in the group, and we're all board certified, fellowship trained radiologists. So we have in basically every area of medicine, we have neuroradiologists, we have musculoskeletal radiologists, and then we actually have 10 interventional radiologists in the group that do all of the interventional procedures that we were talking about.
The advancements, again, are just incredible, Doctor, that's coming along. And unless you stay at the cutting edge, unless Fairview Park continues to do what they're doing, then we'll all fall behind. That's why we're so excited and wanted to come out today and be able to speak with you, Doctor, because Fairview Park keeps taking it to the next level for their patients. So if someone needs some type of procedure done, do they have to get a referral from their doctor? What's usually the procedure?
Yeah, usually you want to go see your primary care doctor, and they'll be the captain of the ship from there. We do anticipate procedures that we're going to be rolling out in the community in the upcoming months and years where you may be able to refer yourself, but for the time being, the best alternative is to check with your primary doctor, talk about the procedure, because it may or may not be right for you.
All right. And let's just back up for a moment. Tell us a little bit more about yourself, about your education, where you gained your fellowship, etc.
Sure. I went to Georgia Tech for college, and then trained at Emory University School of Medicine, did all my residency, my fellowship, my subspecialty training there, and then I came right out of fellowship and joined the group that I'm in about 12 years ago.
Okay. And so I know there's advancement that you expect here, but what do you see in the future with where we've came from with being able to do better and better imaging for people? What do you see the next step?
Well, I think developing the interventional radiology service here is huge, because that's been something that's been a little bit lacking at Fairview Park Hospital. And one thing that's great about that is it allows us to keep patients in the community. So the patients aren't going to have to drive to Macon, drive to Savannah, or Emory or places like that, we can deliver the care that we need, particularly a lot with cancer patients. We're now going to be able to keep you in the community and prevent you from having to drive elsewhere to get your care. So that's one of the main things. And then the hospital is very committed to investment in infrastructure, in the machines that we need to stay on the cutting edge of radiology. We see a lot of investment in that, particularly in areas like 3D mammography. So I think the future for imaging is bright here, and we're certainly going to do our best to keep people here in the community.
Dr. Curtin, talk just a little bit about how much difference that can make for a patient who doesn't have to make a trip, who doesn't have to drive when they're in that shape.
Yeah, absolutely. Sick patients don't want to drive. They don't want to spend time in cars. They don't want to go to a different city. They want to be able to get their treatment. And then when they don't have to be in the hospital, they want to be able to go home and be with their family, sleep in their own bed. And that's probably the most exciting thing about what we're doing with imaging here at Fairview Park, is that we think we're going to be able to deliver that for patients to where they can really get community care in their community hospital.
Just one more way Fairview Park is working hard for our community, Doctor. Speak on that just a moment, about your impression of coming in with Fairview Park.
Yeah, my impression's been very positive. I think the staff here is very committed to doing a good job. They're very eager to learn any of the new techniques that we've brought on board. They've really spent a lot of time training and learning how to support these techniques. And the hospital itself has been very, very eager and willing to invest in what's needed to be a top-notch radiology department.
If you need more information, we have the number on the screen. You can call Fairview Park Hospital. Again, this is Dr. Jay Curtin. He is Director of Radiology here at Fairview Park Hospital. Thank you, Doctor.
Very welcome. Thank you.